UK, including 84,806 tests yesterday. We know that 194,990 people have tested positive, and that's an increase of 4,406 cases since yesterday. And of those who have tested positive, 29,427 have very sadly died. And our hearts go out to everyone who has lost a loved one throughout the coronavirus challenge. We continue to see evidence of a flattening of the peak of this virus, but as the figures that I've just read out show, it's not over yet. So in the coming days, SAGE will update ministers with their latest scientific advice. And as ever, we will make sure that we continue to be guided by their advice as we take the decisions on next steps in fighting this virus. Alongside the advice that we get from SAGE, our 5 tests remain absolutely key. First, we must continue to boost NHS capacity so that the NHS cannot be overwhelmed. Second, we need to see a sustained and consistent fall in the number of deaths. Thirdly, we must see further reductions in the rate of infection to manageable levels across all different settings and areas. Fourth, we must be confident that the NHS will be able to cope with future demands, including as a result of any changes that we make to existing measures or indeed any new measures that we might wish to take. And fifth, and above all, we need to be confident that any adjustments to the current measures won't risk a second peak of infections that could then overwhelm the NHS. Later on this week, the PM will update the country on the measures and the decisions that we will need to take to protect the NHS, to safeguard the economy, and to avoid the risk of a second peak that will be damaging both for public health but also for jobs and the wider economy. And as we consider the decisions that we will take next to protect life but also to protect our way of life, it's now clear that the second phase will be different. We will need to adjust to a new normal where we as a society adapt to safe new ways to work, to travel, to interact, and to go about our daily lives. We've never experienced anything like this first stage of COVID-19 in terms of the scale of the lives lost, but also the lockdown that it has required. And as we go forward, we want to make sure that the next phase is more comfortable, is more sustainable, and prevents lasting damage to jobs and livelihoods. But we need to be under no illusions. The next stage won't be easy. And if we're going to protect life and preserve our way of life, as I just said, we must continue to be guided by the scientific advice we receive and make sure the next steps that we take are sure-footed and sustainable. Now, before I hand over to Angela to run through the data slides, I want to provide an update on one further feature that coronavirus as a challenge has thrown up for this country and indeed for the whole world. Whilst the vast majority of people and countries have come together and rallied to this international mission to defeat coronavirus, there will always be some who seek to exploit a crisis for their own criminal and hostile ends. We know that cyber criminals and other malicious groups are targeting individuals, businesses, and other organisations by deploying COVID-19 related scams and phishing emails. And that includes groups that in the cybersecurity world are known as advanced persistent threat groups, sophisticated networks of hackers who try to breach computer systems. And we have clear evidence now that these criminal gangs are actively targeting national and international organisations which are responding to the COVID-19 pandemic, which I have to say makes them particularly dangerous and venal at this time. So we're working with the targets of those attacks, with the potential targets, and with others to make sure that they're aware of the cyber threat and that they can take the steps necessary to protect themselves or at the very least mitigate the harm that could be wrought against them. So with that in mind, today the UK's National Cybersecurity Centre and the US Cybersecurity and Infrastructure Security Agency have published a joint warning about these groups, and we've offered some advice on the cyber criminals and other actors who are seeking to exploit COVID-19 through malicious cyber activity. Our teams have identified campaigns targeting healthcare bodies, pharmaceutical companies, research organisations, and also various different arms of local government. Now, there are various objectives and motivations that lie behind these attacks, from fraud on the one hand to espionage. But they tend to be designed to steal bulk personal data, intellectual property, and wider information that supports those aims, and they're often linked with other state actors. Now, we expect this kind of predatory criminal behaviour to continue and to evolve over the coming weeks and months ahead, and we're taking a range of measures to tackle that threat. So, as we've done today, we'll share advice on the nature of those threats to enable businesses, citizens, and our international partners to better defend themselves against the full range of cyber attack, from hostile states to criminal gangs. Preventative action is often the very best way to deny attackers the opportunities that they're looking for. The National Cybersecurity Centre offers a range of practical advice to safeguard against cyber attacks, from things like using the use of online passwords to guidance on what are the trusted sources of online information related to COVID-19, like the gov.uk sites or Public Health England. Now, as well as providing practical advice, the UK will continue to counter those who conduct cyber attacks, and we're working very closely with our international partners to respond to the threats, but also to deter the gangs and the arms of state who lie behind them. We're absolutely determined to defeat coronavirus and also to defeat those trying to exploit this situation for their own nefarious ends. And with that, I'll pass over to Professor McLean to give us the latest update on the data.
Thank you. If I could have the first slide, please. So the first slide reminds us what are the 5 tests for adjusting lockdown. And number 1 is that we should always ensure that the NHS has enough capacity, that it's able to provide critical care and specialist treatment right across the UK. The second is that we should see a sustained and consistent fall in daily deaths from coronavirus. And the third is that there must be reliable data to show that the rate of infection is decreasing to manageable levels right across the board. Fourth is that operational challenges, including testing and PPE, must be in hand with supply able to meet future demand. And fifth is that we should be confident that any adjustments that are made to current measures will not risk a second peak of infections that overwhelms the NHS. If I could have the next slide, please. So this is a slide about transport use and how it's changed in Great Britain since February. So those percentages are relative to normal use during February. And the vertical dotted line is the date when lockdown started. And what you see is that for public transport, there has been a very marked and very persistent fall. So that's for bus, for tube, for national rail, and also in grey further back for buses in London. For motor vehicles, so that's the top dark blue line, what you see is a pattern that looks a bit like commuting because it's low every weekend. And we do worry about that creeping up. I think all of us remember that what we've done together, which is to stay home, has worked to protect the NHS and save lives. And as one of the people who looks at this data and thinks about how it fits into how we think about the future, it does trouble me that the dark blue line is creeping up again. Next slide, please. This is the number of tests that have occurred every day in the UK since the 6th of April, up until the most recent data, which are from yesterday. And what you see is that very dramatic rise that happened during April, so that now we do have a lot of tests available that allow us to design the kinds of testing strategies that we're going to need in the future. Next slide, please. This is one of the ways we have of counting how many people in the UK are infected. So in 2 colours here are people who have tested positive. In dark blue, people who are tested by the NHS, And in orange are people whose tests were performed by universities, research institutes, and private companies. So most of the people in the dark blue pillars there are either patients or NHS staff, whereas most of the people in the orange pillars are other key workers. And this data is extremely interesting, but it is quite susceptible to the fact that the number of tests has been increasing and who's allowed to have a test has also been changing. So actually, I find the next slide a lot more informative. So what this is the number of new inpatients in hospitals in England every day with COVID. So this is every day since the 20th of March, either in dark blue, an inpatient who was in hospital and got back a COVID positive test, or in gold there, somebody who arrived at hospital having already tested positive. So this is always the same kind of people, and these people were always the top priority to get a test. So in some sense, this is a much more pure data stream than the one I showed you before. And in fact, to my mind at least, makes much more sense. So what you see is that number rising from the 20th of March until it peaks on the 2nd of April. Now, the 2nd of April is about the date we would have expected it to peak, because that's about 10 days after the 23rd of March, when lockdown came in. And then from the 2nd of April, it falls away pretty rapidly. So what this is the inflow into the hospital system of people who are COVID positive. And we watch this number with great care every day. If I could have the next slide. So if that was the inflow into the hospital system, this is the total number of people in hospital with COVID on any given day. So that's really the balance between people who came in and people who left. And so that has a rather smoother pattern and a much slower fall. And what you see is that that peaked around about the 10th or so of April in London, that the peak in London was much higher than everywhere else, perhaps very slightly earlier, and the fall in the number of people in hospital in London has been faster than everywhere else. So much so now, actually, that in the last couple of days, the number of people in hospital in London now exceeds numbers in hospital in the northwest. Next slide, please. This keeps track of the proportion of critical care beds that are occupied by patients with COVID-19. And what you see is that that also has fallen from its peak in early April, now down to less than a third of all the critical care beds being occupied by COVID-19 patients. It's been decreasing for most of the UK over the last 2 weeks and is beginning to come down to what one might define as more manageable levels. Next slide, please. These are recorded deaths from COVID-19. In blue bars are the actual numbers reported each day. So today, being the 5th of May, we got Monday's figures in. And you can see there's a very regular pattern that numbers at the weekend are always lower than the days subsequently. So that jump from the 4th of May to the 5th of May is something that we would expect. Because this data has such a strong pattern across different days of the week, it makes sense to look at a 7-day rolling average. And that's what the orange line is. And what you can see from that orange line is that the number of COVID recorded deaths is falling and has been falling steadily since the middle of April. Next slide, please. This records registered deaths from COVID-19 by the place where that death occurred. And we've got it for 5 different weeks. And the most recent week for which we have this data is the week of the 24th of April. The grey bars are deaths in hospital. The dark grey bars are deaths in care homes. Pale blue is deaths in one's own home. And dark blue is other places. And what you see is that whilst deaths in hospital have been falling, deaths in care homes in the week to the 24th of April were still rising, to the extent that in that week, deaths in care homes were about half as many as all the deaths in hospitals. I think what that shows us is that there is a real issue that we need to get to grips with about what is happening in care homes. The final slide for today is a comparison of numbers of deaths for different countries. The UK, which is COVID deaths in all settings, is the grey line in the middle there. And what you see is that deaths in the UK is still continuing to climb and is higher than we would wish, I think is all I can say. And with that, I can end the data slides for today.
Angela, thank you very much. We'll now take some questions, starting with questions from members of the public. Do we have Bren from Gloucestershire there?
My name is Fred McInerney, and I volunteer in the local community in Gloucester, Gloucestershire. My question is, as we come through the tough times of COVID, how can we embed our reflective learning so as to ensure we address inequalities across community and neighbourhoods and continue to invest and empower local communities to thrive? Thank you.
Well, Bren, thank you very much. And I want to pay tribute to everyone in Gloucestershire, from the key workers like the NHS staff to people working in care homes to all those doing those critical jobs, whether it's in supermarkets or running deliveries, which have kept the lifeblood of our communities going. I think you're absolutely right to say that, particularly after a pretty unique pandemic, something that certainly I've never seen before in my lifetime, we will all want to learn lessons in this country and across the world. And I think one of the things that we found with coronavirus is it hasn't discriminated. We've got the Prime Minister who's been laid low with it. We've got people all across the country. No one has been impervious to this virus. And I think it's also taught us to appreciate those key workers that I mentioned, not just those in the NHS and care homes who are obviously doing an amazing job, but also those keeping our supermarkets running, keeping deliveries flowing, and up and down the country. And as you will probably remember from the general election, the Prime Minister's big overarching goal is to level up right across the country. And I think this crisis has been a timely reminder of how important that agenda and that political agenda is going to be. But first things first, we've got to get through this crisis, recover, bounce back if we can, the economy, make sure those small businesses and the employers are fit and we provide them with a bridge through the current set of challenges, and make sure, I think, we come together as one country, as I think we've seen in this national mission to tackle the coronavirus, and try and keep that spirit alive as we go forward. But I think there are lessons to be learned, and there are opportunities to learn those lessons in a really positive way when we come through the immediate crisis.
May I?
Angela, please, if you've got...
I think you raised an incredibly important point, Bren. Infectious diseases always do and always will target the disadvantaged. And I think one of the things that we fear as we hopefully bring the incidence of infection, so the number of people who are infected every day, right down to very low levels, is that infection will disappear into parts of our communities that are really, really hard to reach. And I think it's incumbent on all of us, including us scientists, to find ways that we could make sure that we can track the ongoing spread of infection amongst every part of our society.
Yeah, thanks, Angela. And I think next up is Jane from West Yorkshire. I think we've got a... Jane from West Yorkshire asks, I'll read this out because we've had this one messaged into us. In respect of the track and trace app, is this something that will work worldwide once travel can begin again? And if not, why was this not embarked upon as a global initiative? I think the reality is we want the app to be focused on the UK, and we want the technology to be tailored to make sure we can deal with the specific challenges that we've got in this country. We've worked with the experts we've got in the National Cybersecurity Centre to make sure we've got the greatest protections on things like privacy, and we've got very high standards, both of professionalism but of privacy, as we embark on what will be an unprecedented IT project. And not everyone and not all countries around the world will have the same standards, whether they're tech standards or whether they're privacy standards. So I think it's right to say we should learn internationally about the tech innovation that's going on, but we want to make sure we've got something tailored to UK needs, and we're applying the very highest UK standards. Angela, I don't know if there's anything you'd add to that.
I think, no, that's a good point.
All right, thank you, Jane, for that question. We'll go on to ask David Shukman from the BBC, onto the media. David.
Thank you very much indeed. Yes, a question about the death tolls, looking at the official figures that you've just announced and comparing them with figures announced this evening by Italy. It does now seem that the UK has had more deaths from COVID-19 than any other country in Europe. If it does turn out that we are the country that's hardest hit in Europe, what's your reaction to that?
Well, thanks, David. You're asking me to speculate there. All I'd just say is, first of all, 29,427 lives lost is a massive tragedy, something in this country on this scale, in this way, that we've never seen before. And as I said before, my heart goes out to anyone that's lost a loved one. In terms of the comparison that you're suggesting, I, as the scientists have all said, I can remember Patrick Vallance and Chris Whitty talking about this. I don't think we'll get a real verdict on how well countries have done until the pandemic is over, and in particularly until we've got comprehensive international data on all-cause mortality. But I think there's 2 points that I'd make about the way the UK has approached things. There are different ways of counting deaths. As we know, we've had that debate in this country. We now publish data that includes all deaths in all settings. Not all countries do that, so I'm not sure that the international comparison works unless you reliably know that all countries are measuring in the same way. And it also depends on how good, frankly, countries are in gathering their statistics. And our own Office of National Statistics is widely acknowledged to be a world leader. And one of the reasons we've embraced that is because we want the transparency, because we are confident and we believe that it's only if we get the full transparency that we'll be in the best place to tackle this virus. So I think it is important, but I don't think you can make the international comparisons you're suggesting at this stage. Not, at least, I don't think you can make them reliably. Angela.
I would just reiterate, I think we have decided that our measure of how things have gone will be age-adjusted all-cause mortality. Because that will capture all kinds of impacts of COVID, not just the COVID deaths. And clearly it'll be important to do what we can to make international comparisons. Everybody knows that making international comparisons in such statistics can be difficult. And it may be that will take some time to sort out, and this isn't over yet.
Dave, do you want to come back on any of that?
On another topic, if I may, last week the Prime Minister suggested that there may be situations where there could be benefits from the public wearing masks. Does that mean that UK government policy on this has changed? And if it hasn't changed, might the public be forgiven for being a bit confused?
Well, of course, you're always trying to tempt us to get one or two steps ahead of the game. The reality is we're considering the SAGE advice. That advice has been nuanced, if I can say it like that. The evidence is rather finely balanced, but we'll make sure that we consider it very carefully. One of the things we don't want to do is give people inaccurate advice or create false confidence or comfort in masks. And also there's a key difference between masks that, for example, the self-made masks that some people around the world are being encouraged to use, and the clinical masks that we need for the NHS. And we do not want to detract from the supplies of masks and other PPE, frankly, going to the front line in the NHS or care home workers. But the wider advice we'll consider and shortly be saying more on. Angela, is there anything you'd add?
Nothing to add.
Thanks, David. Robert Peston at ITV.
Good afternoon. I absolutely accept that it's too early to draw firm conclusions about whether our death rate will be the highest in Europe. But Angela, you just said, when pointing to your own chart of international comparisons, the death toll is higher than we would wish. On the basis of that, we have recently instituted a new system of mass testing, and we're recruiting lots of people to do tracking, tracing, and quarantining. Would you hope, when this new infrastructure is in place, that death line will track down to nearer Germany and Korea, which have much lower death rates. Because after all, as Chris Whitty said on Friday, we're going to be living with coronavirus possibly forever, and the lethality of coronavirus, it's going to take us months, if not years, to get it down.
Well, Rob, let me have a first stab, and then I'll hand over to Angela. I mean, the first thing to say is that the big thing that has helped us flatten the peak is the public's adherence to the social distancing guidance that we've laid out. Not only has that helped reduce the number of deaths there would otherwise have been, they could have been higher, but it's also helped us preserve NHS capacity, which means that we've been able to deal with COVID-19 patients, but also other patients. I think the key is going to be with test tracking and tracing, is going to be the extent to which it gives us the flexibility to transition into a second phase safely, in a sure-footed way and sustainably. And I think that's the key to the test tracking and tracing. Angela.
So that last graph that I was showing you is actually cumulative deaths. So there is no way it can go down. The very best that it can do is go flat, because once there are no deaths, it becomes completely flat. And of course, I want it to become flat for the UK as quickly as possible. And the only way other countries could catch up would be if they had more deaths, and I'm certainly not going to wish that on anybody. So I think if the sooner all of these can settle down to flat lines, the better.
Rob, do you want to come back with any more?
Yep. But just on that, do you think mass testing, tracking, tracing is going to be the big initiative that gets that curve to flatten in the way that we all want?
Yeah, I mean, I think we're all of us working really hard to figure out if we can do contact tracing in a way that will really start to find all of the infections out there in the community. Find people who have symptoms, get them tested, find good, quick, reliable ways to find the people they've been in contact with and ask them to go into quarantine. That is the strategy that has worked in South Korea. And South Korea is really the place in the world that we can look to and say this worked. It's a large country like we are. They did have quite a big outbreak, actually, that they brought under control with contact tracing. So I think they are a fine example to us, and we should try to emulate what they've achieved.
And Rob, I think we need to be really clear about the moment we're at and the relevance and the value of test tracking and tracing. Our real risk right now as we come through the peak, we start to see us come through the worst stage of this crisis, is that we move to ease up too early without having a sensible, sure-footed plan, and we see a second spike or a second wave. Test tracking and tracing allows us, as well as getting the R rate down through the social distancing measures, which gives us extra flexibility. Test tracking and tracing allows us to manage that very carefully, because any second re-emergence of the virus, wherever it may be, we can control and measure and monitor very swiftly. And I think that's the crucial importance of it. Sam Coates from Sky.
Angela McLean, the Scottish Government today released scientific research suggesting that if schools go back north of the border, then hospitals could be overwhelmed there within 2 months, and in the worst case scenario, become more than 7 times oversubscribed. Is that based on science that you recognise, and what might be the policy lessons that you could draw from that? And First Secretary of State Boris Johnson has said that there will be some delays at the border when we leave the current Brexit implementation period. Today, we also began trade talks with the US. Given the level of uncertainty facing the economy and business, is this additional burden the right thing to do at this time? Or conversely, do you think that there are actually benefits from doing Brexit talks at this time?
Well, look, I think there is a whole load of uncertainty. And I've worked very closely with my European opposite numbers right across Europe, and actually it's been a good example of, frankly, in this challenge we come together, we work on practical cooperation, whether it's PPE procurement or returning our nationals, and we have very close cooperation. It reminds us of the ties that do bind us together. I think on all sides we'll want to avoid any further uncertainty. So actually the smart thing for us to do is focus on the track that we've got. Are we making good progress, or we're making progress, I should say, in relation to the future relationship negotiations. We're not there yet. But the right thing to do, I think, for the UK, but also for the EU, is to avoid any future uncertainty beyond the end of this year by agreeing what ought to be a reasonably straightforward approach. Negotiating the detail will never be entirely straightforward, but because it's based on the standard precedents that the EU has adopted with other third countries, and that will be the surest way to make sure we can give our economies a boost by maintaining seamless and as frictionless trade as possible. And that is the way both the UK and European countries got an opportunity to bounce back after this. I think prolonging the uncertainty of the Brexit negotiation is unnecessary and would actually make that uncertainty worse. Andrew, on the one for you.
So I don't know the study that you're talking about, but I do know that there are some profound uncertainties in the underlying data about how likely children are to catch COVID and how infectious they would be if they caught it. And it's really quite difficult to trace because they tend not to have symptoms really, or their symptoms are very mild if they do catch it. So there's not very much data because there haven't been many children with symptoms, and of course most schools have been in lockdown for a long time now. So it's perfectly possible to produce projections for what's going to happen based on reasonable interpretations of rather a thin evidence base that go either way. That being said, one of the things that everybody is very clear about is that whatever we change, we will make absolutely sure that we were monitoring the situation so that we don't get explosive outbreaks, whether those started in schools or in workplaces. So I don't imagine any country in the UK having an outbreak that would overwhelm their health systems sevenfold. One of the things we can do, as well as making the absolute most of all the data that we do have, is to watch very carefully for those in those countries that have reopened their schools and see what happens there. So that's one of the several things we are doing in order to make a decision based on as much science as we can find about what is likely to happen.
Sam, would you like to come back on any of those points?
It was just in the answer to my question for Secretary of State, you corrected yourself from good progress to just progress. Why is the end of year deadline quite so important given the massive scale of the pandemic crisis that we're facing?
Well, I know that if we talk about the positives of this, there'll be someone somewhere on either side of the channel who will say, "Oh no, it's going terribly." The reality is, progress has been made, and we're confident we can get there. Look, we do face a challenge with coronavirus. There'll be damage to the economy. We want to bounce back, but actually, one of the things we know that businesses would like some certainty of knowing that this has been concluded. I think the country wants some certainty, and we were elected on that basis. And actually what this crisis ought to allow us to do, not least through the goodwill and the spirit of cooperation that we've had with our European partners, is to knuckle down, focus on what really matters, agree a pretty well-precedented free trade agreement with our EU partners, which they've already agreed with other third countries, and allow both sides to move on in that spirit of cooperation and goodwill that I mentioned. So that's what we'll be focused on. Thanks, Sam. Thank you very much. Jason Groves from the Daily Mail. Jason.
Hi, thanks. Foreign Secretary, can I pick up on Sam's question there about schools and ask what you think the prospects of them reopening are, given the profound uncertainties that Professor McLean talks about, and the fact that Scotland seems to be pretty clear they're not going to be opening their schools anytime soon. And Professor McLean, can I ask you about one of the emerging risk factors, that of obesity? There seems to be a lot of interest in this subject. I wonder, could you tell us anything about how much evidence there is that it's a risk factor, and whether people should think about going on a diet?
Jason, thanks very much. So on the issue of schools, first of all, I really feel for parents who've had the challenge of balancing working from home with homeschooling. I feel for the teachers who have had to make that work as well. I think there's been an exceptional effort to make that viable and to make it work. It's also, schools being closed has an impact on the economy because so many of those workers can't go back to work as normal. The crucial bit for us is the 5 tests and the risk of a second spike in relation to any new changes that we would make, but that must, of course, include schools. So one of the things we've done is we've asked SAGE to look at different options. I don't think it's binary. And I think the one thing I can say with confidence is, at least to date, the evidence has been that we wouldn't be able to open up all schools without a very real risk that the R rate, so the transmission rate, would rise at such a level that we would risk a second spike. But we've asked SAGE for the options on this, and will, as ever, continue to be guided by the scientific advice we get.
And you wanted me to talk about obesity. So we have very fine evidence, actually, from rather beautiful studies gathered from inpatients in our hospitals with COVID-19. And those studies show that, indeed, once you're in hospital, being obese is an additional risk factor for being admitted to an ICU or, indeed, for death. My understanding about the way to lose weight is that going on a diet isn't the way to do it, and what you have to do is actually decide to completely change your lifestyle. You have to decide to do something that's going to be enduring, not just going on a diet. And I understand that that's a really difficult thing to do, but under all circumstances, pandemic or no pandemic, it's better not to be obese.
Thanks, Jason. Can we go on to Andy Dunn from The Mirror, please?
Yes, Foreign Secretary, in France and Holland, professional sports has been suspended until September at the earliest. But here, the Premier League is making extremely detailed plans for a possible return in mid-June. Is this realistic? And is the government actively encouraging it as a measure that might somehow lift the spirits of the nation?
Well, do you know what, Andy? I think it would lift the spirits of the nation. I think people would like to see us get back not just to work and get to a stage where safely our children go to school, but also enjoy some of those pastimes, sporting in particular. There have been, I know the government's had constructive meetings with sports bodies to plan for athletes to resume training when it's safe to do so. I can tell you that the Culture Secretary has also been working on a plan to get sports played behind closed doors when we move to the second phase. So that's something that I can tell you we're looking at. Of course, we'll come back to the key point though. We can only do it when the scientific advice is that it can be done safely and sustainably. But certainly that's something under active consideration. Andy, anything else you'd like to ask?
Yes. When you say safely, will there always be an element of risk if Premier League footballers or any footballers, any sportsmen go back to playing? And secondly, if we are, as you've now said, professional sports will be behind closed doors, will that be the case until a vaccine is found, whether that be 12 months, 18 months, 2 years? Are we looking at professional sports behind closed doors until that moment?
Thanks. Look, I can't look too far into the future because there are various different ways we could get control of the virus permanently, defeat it for good. A vaccine is certainly one of those. Therapeutics are another. I think we're all waiting to see how effective internationally test, tracking and tracing can be, but I think that's also an option. But whether it's a combination of test, tracking, tracing and other social distancing measures within what's possible within a sporting environment, we want to see whether behind closed doors what the options are for doing that. So I think it's worth taking a close look at that, seeing whether it's possible to do it safely, but as ever taking the scientific and the medical advice as to when and how to proceed. Andy, thank you very much. I think finally we've got Will Hayward from the Western Mail and Wales Online. Will.
Thank you. My first question is for the Foreign Secretary. Watching these press conferences for the past 6 weeks has been very confusing for many people in Wales, as some of the language used makes it very unclear if what is said applies to them because of devolution. Clearly, foreign affairs, such as repatriating people from abroad, does apply. However, commonly mentioned issues around schools, local government, support for vulnerable people, healthcare, and even the rules of lockdown itself do not actually apply to people in Wales. Do you concede that the government could have been clearer up till now? And will you and your ministerial colleagues commit to making the distinction as to what issues apply just to England in the future?
Well, all I'd say is, and I've, in the PM's absence, I chaired 2 of the COBRAs, I've been in a number of others. We've had, I've got to say, good cooperation with all the devolved administrations, including with the First Minister in Wales. If you look in practice at the social distancing measures, and I talked a bit earlier in this press conference about the level of compliance, it has been remarkably consistent across all of the nations. So we've actually been pretty much in lockstep all the way. I think the right thing to do is to try and proceed on a consistent basis, respecting the constitutional settlement, of course, and that's what we've done so far, and that's one of the reasons we've been so effective. So I think we can pull together and, as one United Kingdom, see ourselves sustainably through this crisis. Angela, is there anything you'd add to that?
There's not much I would add. I mean, I think we've succeeded so far together, and that would seem a sensible way to go forward.
Great. Did you want to come back on any of that, Will?
Sorry, the point I was making was as much about the language in these press conferences for people in Wales who naturally might not be that well versed in every bit of minutiae around devolution. My second question is actually follows on from that. The First Minister of Wales has stated his desire for Wales and England to come out of lockdown together in order to keep the message simple. How is Wales able to input into the announcements about lockdown that we are expecting this weekend and next week? And just to Professor McLean, if I may, does SAGE take into account Welsh data and the impact on Wales when offering advice to NHS England? And has there been any marked differences between Wales and England?
So just in terms of the formal structures, it's really important that we do try and make sure that there's early and consistent and continued cooperation and consultation. So we do that through the Welsh office. Michael Gove and the Cabinet office are doing it. And of course we have those COBRA meetings that I discussed, which bring all four nations of the United Kingdom together. And actually, you know, we're flexible, we're pragmatic. We're not insisting on form over substance. But actually, if you look at the substance, and I come back to the consistent record of compliance with the social distancing measures, we've done a pretty good job of working together. So I think the key thing is that there's the political will on all sides to continue that, and I hope and I'm confident that there will be. Angela.
So on the science, we work very hard to include all four nations. Sometimes there are data streams that we only have for England at the moment, but we do try to make it clear to our colleagues why we think they're incredibly useful, and therefore why it would be fantastic if we could also have them from other countries. So both on SPI-M and also in SAGE, yes, we certainly do think about Wales, I promise you.
Will, thanks very much. That brings this press conference to a close. Thank you all very much.
Thank you very much, Doug, for being with us.
Thank you, Mr. President.
Secretary Eugene Scalia, thank you. Eugene.
Pleasure.
Senator Martha McSally, who's doing very well. I hear things are very good. You're doing great. Thank you, Martha. Vice President of Navajo Nation, Myron Lizer, and by the way, we appreciate it very much. And you know, there's two ways of saying that name. They told me outside, but I always think of it as Lizer. So how do you like it? How do you like it? That's what I thought. Okay. Thanks, Myron, very much. And Second Lady, thank you very much for being here. We really appreciate it. The Navajo Nation has been very special to a lot of people, and it's certainly been very special to this state. And the relationship, Doug, I think is extraordinary, isn't it, when you get right down to it. So thank you very much, and we very much appreciate it. Native Americans have been hit hard by the terrible pandemic. Over 2,000 members of the Navajo Nation have tested positive for the coronavirus, and tragically more than 70 have lost their lives. How is it looking right now? How's it doing?
Well, the numbers are still rising. We're hoping that it flattens. Our health professionals have said that the peak will be in mid-May, and it's kind of uncanny, and it's fallen that way. So 2,400 infected with 73 that have succumbed, and that's too many.
That's a lot. Mitigation-wise, you're doing what?
We have shut down enacted a 57-hour curfew over the weekend. Our people love to travel out to the border towns off the reservation. Recently, the National Guard came in and shut down Gallup under a new mayor leadership in Gallup, New Mexico. So they've been on lockdown for 5-6 days now, and so that's helped. But our people are readily going to other border towns like Flagstaff and Farmington, New Mexico. So I think the supermajority are obeying and staying home.
Well, what we're doing, you know, we're bringing these two. These are very hard to come by because they're very popular. This is done by Abbott Laboratories, and we're bringing them for you. And these are the quick tests, and they're very accurate and very fast. So we're doing that. I think we have 1,000 cartridges too, 1,000 for 1,000 tests. So hopefully that'll be helpful to you.
Yes,
we appreciate it. Because you've done a fantastic job. You've been great friends. Native Americans have been hit hard by this terrible pandemic. Over 2,000 members of the Navajo Nation have really, I mean, it's been incredible what's taken place, and there's nothing we can say. But the coronavirus is tragically, as you just said, 70 people lost their lives. The administration is deploying the full resources of the federal government to support and protect our Native American communities in this very grave time of need. And I know that I think I can speak very strongly for Martha and for the governor. We're full hands on deck, and you're working very hard. I know that, Doug. Work very, very hard. And even Department of Labor. It's been working very hard with everybody that's in this room and everybody that needs to be, right? Anything you have to say, by the way, Gene, while you're here, please?
It's a pleasure to be here. It's wonderful being on the road again, as you know, Mr. President. And then great being in Arizona, which is such a spectacular state. And the Native American communities here are such a great part of the state and really our nation and our nation's heritage. So it's so good to be here. I know, Mr. President, you have an important announcement to make today about additional things we're doing to help these tribal governments. And we're certainly doing all we can at the Labor Department to implement the legislation that you signed. You got enacted so incredibly quickly. People forget, 3 weeks in March, 3 major pieces of legislation with paid leave, with unemployment benefits, and with the Paycheck Protection Program to put us in position to get going again. And now, Governor Ducey and I were just talking about it, we're reopening. And it's a wonderful thing to see. I think we're well positioned. And I think, Mr. President, with your leadership, we're going to get back to where we were just a few weeks ago. Things were going so well, and we'll get there. We had a nice conversation, the governor, Vice President, Second Lady, and I, a little while ago, talking about some of the things we're doing at the department. I mentioned these dislocated worker grants that are made available also to tribal governments. So I urge you to look into that and see if we can help you with that.
And I'd like to introduce also the governor, Stephen Lewis, who's been terrific and working with us very hard. Thank you very much, Stephen. It's fantastic. We appreciate it very much. How is it going?
Well, it's going to a point where we're trying to keep beyond the curve as well. We're located just not far from here, our traditional lands and our reservation land base.
That's Gila River.
Gila River, home to one of the flag raisers on Mount Suribachi, Ira Hayes.
Right.
And
that's beautiful territory, isn't it?
It is. Thank you, President.
But it's how are you doing in terms of the amount? What are your numbers now, as of today? What are your numbers?
Our numbers, we've tested over 1,000. We've had about just over 1,100 tests. We've had 1 fatality. We have 44 positive tests. Our tribal community is around 23,000 members. So we are keeping ahead of the curve, but I know testing is a big issue, and also thank you for working with your administration on getting one of the Abbott analyzers as well. We were one of the first tribes to get one as well, and then also working with Governor Ducey, getting 5 ventilators as well.
That's right.
We run our own health care, independent of the Indian Health Service, Gila River Healthcare.
That's great.
And so we hire our own doctors, we put our own communities members to work, and from other tribes as well. And so we're taking care of our own tribal members on this. We have we have an incident command that we've started as well. All of our departments are collaborating for one purpose, and that's to keep our community members safe, Mr. President.
That's fantastic. Good. And you'll have the ventilators there soon, I know, right? Knowing Doug, they're good ventilators too, aren't they?
Yes.
Right? They're really good. Weeks ago, I signed the CARES Act, which includes $8 billion to help tribal governments, and I want to thank Senator McSally for fighting hard to get those funds and get them here and get them to a lot of different people all over the country, including to the folks in this room. So I want to thank you, Martha. You've done a fantastic job. You really have. This is the single largest investment in Indian country in our history. So the amount of money that's being sent to Indian country, as we call it, is the largest amount in the history of the U.S., and you deserve it, and you've been through a lot. The Navajo Nation will soon receive over $600 million. That's a lot. Should I renegotiate that? Can we renegotiate? Only if we go up. He said only if you go up. I understand. I've heard that before. The Lihu River will receive, and I think you probably know all about this, but we're giving you some information, $40 million. And you're going to use that very well. I know that because I know you. You're going to be given $40 million in initial funds to help protect their citizens from the scourge, from the plague, from what we're all fighting in this country. Should have never happened. Should have been contained from where it came. Since I took office, my administration has also worked to repatriate precious Native American artifacts to protect children in the care of the Indian Health and Indian Health Service, and to make eagle remains more easily accessible for cultural and religious purposes, and to highlight the contributions of Native American veterans throughout the history of our nation. So you know all those elements. And the eagle remains is a very important thing to you, right?
Oh, yes, sir.
Very important. Yeah, that's great. That's great. Last year, I signed the first presidential proclamation recognizing the tragedy of missing and murdered American Indians and Alaska Natives. We also launched Operation Lady Justice and provided $273 million to improve public safety in Native American tribal communities. At the end of this event, I will once again sign a proclamation recognizing missing and murdered American Indians and Alaska Native Awareness Day. It's been a tremendous problem, missing and murdered American Indians. It's been could you discuss that for a second, please?
I don't want to steal a second lady's thunder here.
I'd like to have the second lady. Go ahead, please.
Well, Navajo Nation has been really hit hard by missing and murdered Indigenous women. It seems to be a growing issue that's been happening with Navajo, and so we, with the Ashlyn Mike case that came up in 2016, where she was kidnapped and raped and murdered in Shiprock, New Mexico, May 2nd, 2016. So that's kind of what opened the door for Navajo to start saying, okay, we need to do something, because that became the forefront. And so since then, the Amber Alert on Navajo Nation has gotten better, but still needs help with funding, still needs help with getting the data together. Our First Lady, Cecilia Nez, is also part of the New Mexico task force that's getting together data. And so we're just really needing help in that sense. And so we don't want to lose any more of our Native sisters, our Native mothers. And so the cry is to get the awareness out, because a lot of people don't know of the missing and murdered Indigenous women and girls, and now it's hitting the LGBTQ community. And so we just want to make that aware and know that, hey, we're waving our arms here. I think there was a movie that came out with Native women that have been murdered and missing. And so it hits close to home, because we have a close family member, Patricia Platero, that went missing in 2015. They found her 2 months later murdered in Albuquerque, New Mexico. And so her case still remains unsolved. We got Tamika Platero, who's from Little Water, New Mexico, who went missing November 25th, 2019, and is still missing. And so we have these girls out there that are missing, and we don't know. And there's that jurisdiction.
Been far disproportionate to other people and other areas of the country. What you've gone through. I mean, I've been hearing about this for a long time.
Yes.
For years and years. This has been for many years, for many decades, right?
Yes. Yes.
Disproportionate.
Yes.
Disproportionate. Yes. Well, $273 million, a lot of that's going to go toward trying to solve that problem. It's a problem that can be solved. Thank you, Mr. President.
Thank you, Mr. President.
I know you're going to use it well.
Yes.
And you'll figure it out, right?
Yes.
It's a horrible thing. So New Mexico versus Arizona, tell me, because we're here. Where are you going to be, where's the problem worse? New Mexico or Arizona?
Navajo Nation spans Utah, New Mexico, and Arizona. And so, I think all of us working collaboratively, that's going to really help, because sometimes we get misclassified. We get misclassified as Hispanic. And so I think there was a Hopi girl that had been murdered here in Phoenix, and they classified her as Hispanic. And so a lot of times, the people don't know. So I think with the more talks out there, that people will, start to
Is there a
understand.
certain area, though, or you have the 4 states, is there a certain area where the problem is exacerbated or worse, or is it?
Well, I think it's just all Indian country, Indian country, whether it's Alaska Native or Navajo or Hopi or Gila River, it's all over.
It's a very big problem in Alaska.
Yeah, Mr. President, if I could add to that, just recently in Farmington, New Mexico, there was an Anglo woman who was abducted, and I'm most certain she came across the Navajo Nation and was found murdered in near Flagstaff, Arizona. And so I think it just speaks largely to the lack of public safety officers in such a vast land, the size of West Virginia.
It is a vast land.
So not only Navajo and others, but it's just an area that I guess because there's not as many public safety that you get those
Well, I'm going to be signing something in a couple of moments, and I hope it helps a lot, not just a little bit, a lot.
Yes.
And I think you'll do a fantastic job. I know you're going to be watching it personally.
Yes.
And between the 3 of you and everyone else that I know so well, I think you're going to do a great job. And so go get them.
Thank you, Mr.
Go
President.
do the job. I'd like to maybe finish off with the governor. Great governor. You're doing a phenomenal job. What do you have to say, Doug?
Well, my mic thankfully is working. First, I want to say thank you, Mr. President. We're thrilled that you're back in Arizona, especially to talk these specific tribal issues. I want to say to Second Lady Leiser, to Vice President Leiser, to Governor Lewis, this focus that we've had on our tribal nations, first and foremost, around the coronavirus, with a special shout out to Senator McSally, who advocated for these ventilators that were so needed on Navajo Nation. Please extend my best to President Nez, and I'm so grateful, Mr. President, that you took a personal interest in getting these ventilators to Navajo Nation. And I'm proud, Mr. Secretary, in Arizona, our legislature, both Democrat and Republican, last year signed HB 2570. And Second Lady Leiser, I want to give a personal thank you to you. This was the bill to address missing and murdered Indigenous people. And what we hope to do in Arizona is to reduce and eliminate this scourge that we have on our native nations. And in Arizona, we have 22 tribal nations, and 75% of the Navajo people reside in the state of Arizona. So that was a positive thing that we could get done last year. And Governor Lewis, I want to say to you, another positive thing in addition to the HB 2570 that we passed, it was also unanimous, was the drought contingency plan to address Arizona's water future. You were a real leader on that, and for that I'm grateful. Thank you for being here to celebrate these accomplishments, Mr.
And you know, one of the other accomplishments we have is in Arizona and a lot of other states, we're building a wall, and you're finally getting what you need. And interestingly, California's calling, because in bordering towns, as you know, in Mexico, they have a very big outbreak of the coronavirus. And California's calling, saying, you got to help us. Those are not calls that the media knows about, but that's the facts. And in Tijuana, right along the border, they have a tremendous outbreak. And we have just completed 172 miles of wall. And it's real wall, not the kind you were having built over the years that were sort of scoffed at, right? And we've done a lot in Arizona, and the people are letting us know they're so happy, they're so thrilled about it. It's made a tremendous difference, and we've had one of the best months ever in the history of our country for not having people come in that we don't want in our country. We want to have the people that come in the right way. So you see the numbers. The numbers are about the best we've ever had in the history of the country. So it's good. But we're getting that done. I guess you see where they're doing it?
Yes.
Yeah, it's been a big thing. We're up to 172 miles. We'll have it completed early next year. So it's been something. Okay, I'm going to sign this. I want to just congratulate you, Myron.
Yes, sir. Thank you.
I want to congratulate you, Second Lady. That's so fantastic.
Thank you.
And I want to congratulate you for also, because I've been in that vicinity, and it's one of the most beautiful places you can imagine. So congratulations very much. Thank you, Stephen.
Mr. President, what are your thoughts on winding down the coronavirus task force?
1 second, Jim.
Yes, sir. Oh, sir.
I want to make sure everybody looks good, except me. I'm going to hand this to the Second Lady, okay? No, you don't mind.
Mr. President, I want to thank you.
Go ahead, please.
I want to thank you again. I'm wearing my red ribbon in remembrance of this significant moment for missing and murdered Native Americans. And again, I want to thank you for making such an announcement today and for signing an important document to commemorate the National Day of Awareness. And I know that your administration also made another very important announcement today regarding the Coronavirus Relief Fund. And thank you for that. And to take a few moments to comment about that as well. I want to thank, of course, Governor Ducey and Senator McSally for advocating and for making sure that this is getting out to Indian country, this much needed resources as well. And so today your administration made a significant impact across Indian country. And I want to thank you for getting some of the money out today. I want to thank you also because we need help now, Indian tribes, and can't wait for that litigation to end before additional payments are made to us from the fund. And if you can, please direct Treasury to make these payments as soon as possible. And three, we need to spread the limited resources resources currently available as far as we can, and to avoid allocating to a very few tribes and under-allocating to most others. And this means that you should include a limit or cap on the total funding any one tribe receives. And we need to have flexible guidance to allow us to use the funds we do to receive, that we receive to keep our governments running, Mr. President. And the current fund of $8 billion is going to be woefully inadequate to meet our overall needs. And we really need to work, and we will work with Senator McSally and your administration to take this to the next level. And I look forward to working with Senator McSally, with your Chief of Staff Meadows, Congress, and your administration on the next relief bill, Mr. President. Thank you, to make sure that your investments in Indian country are going where they are needed the most, and in a way that shows that our governments and our economic entities can be part of that recovery that we are talking about here. That will be critical as we come out of this crisis and rebuild our tribal, state, and national economy together with Indian country included, Mr. President. I always end my my video messages to my community members. We're all in this together, right, and to continue to be Gila River strong. And I think that is how that we can continue to be Gila River strong and to strengthen all tribal nations moving forward, Mr. President.
That's good. Thank you very much, Stephen. I appreciate it. I have to say, Myra and Liza and I have dealt, and our people have dealt together very closely, and the Second Lady, and a lot of progress has been made, and we'll continue to make a lot of progress. I think you'll see that, and I think you're going to see it not only here, but in the future. Thank you very much, and I appreciate it very much. Thank you. Thank you, Governor.
Thank you, Mr. President.
And I don't have to thank you. You're with the administration. He has good genes, though. You know, he's got good genes, right? The Scalia genes. You don't get better than that, do you?
They're good.
Mr. President, on winding down the task force, Vice President Pence said there are discussions underway about winding down the task force. Is that a good idea during a pandemic?
Well, I think we're looking at phase 2, and we're looking at other phases. The country's starting to open up. The task force has done a phenomenal job. We have a chart that I just showed somebody. We just got it this morning as I was getting off the plane. And Governor Ducey can explain it better than anybody. When we came in, ventilators were a very, very big deal and very hard to produce. I say, but it is largely true. The complexity is sort of like building a car. We opened up operations all over the country to build them, and hasn't been one person that needed a ventilator that didn't get it, which is amazing. And now we're helping other countries, and we're stockpiling in case some tragedy like this happens again. But this just came out on testing, because I think we are at the point, or maybe we'll soon be at the point, where I can say the exact same thing on testing. These numbers were just released. And this is the United States, the amount of testing and our level of testing and the quality of testing. This is just from Abbott Laboratories. This is, you know what this one is, Jim. It's a 5-minute test. It's a great test. It's something people like, because you don't have to go through a laboratory. You don't have to send it in and send it back, and it takes a couple of days if they do a good job. So this is the testing, and the line here is the United States. We're over 7 million tests. Germany is at 2.5. Italy is less than that. Japan is down here, in South Korea, which we talk about. And again, I'm very friendly with South Korea and with the president of South Korea. And he calls to congratulate us on our great testing. South Korea is over here. One of the reasons we have more cases than any other country by far is because we test much more. So if you test, you can have more cases. If we tested down here, we wouldn't have very many cases. You know, they like to say we have more cases than anybody, but the fact is, when you look at these numbers, and this is the official count. Now, I can't tell you whether or not other countries are giving us the straight deal, but I can say that I know one thing: it's only going to be on the high side, not going to be on the low side. So this is the other countries. These are the United States, and it's incredible. Remember this, and I think it's important to say this, Jim. The quality of our test is also the best. I mean, it's acknowledged to be the best. So again, when we have cases, and we have more cases than anybody else, does anybody really believe that we have more cases than China? But they don't talk about numbers like this, and other countries. But we report everything. And
don't you want to hear from the experts?
I just want to say that we've done an incredible job on testing. With that being said, we have some additional, including antibody tests coming out that will even blow these numbers away. But nobody's done the job we've done. Go ahead.
But don't you need to continue to meet with the task force to get this scientific expertise on the pandemic?
We will have certain people, as an example, we have hospitals that we built. We have medical centers that we built. We have people on the task force that focus on that. We have people on the task force that's focused exclusively on ventilators. Well, we have more ventilators now than anybody in the world, and we're helping France, as you know. We're helping France, Italy, Spain, Nigeria. We're giving, I think, 250 to Nigeria. We have many countries that we're helping, but the ventilator problem is solved, so you don't need that. We have now it's sort of a combination of safety and reopening. So we'll have something in a different form. But the task force, for what we've done, I think everybody out there, when they're being very honest, I think the job we've done on testing will shortly be, and maybe even supersede, Doug, the job that we've done on ventilators, which people can't even believe. We had a call the other day with the governors. Mike Pence took the call, and they had, I believe, all 50 governors. And it was, they say, the best call we've had thus far. We're working closely with the governors. They have everything they need. And if they don't have it, and if they don't need it, or if they can't get it locally, and then they know that we are stocked and we are ready, and we can have, as an example, we won't need this, but we were ready for weeks to have, we had 10,000 ventilators sitting in various locations with people by the ventilators ready to have those ventilators roll if they needed them in, as an example, Detroit or various other places over the country. So I think that as far as the task force, Mike Pence and the task force have done a great job, but we're now looking at a little bit of a different form, and that form is safety and opening, and we'll have a different group probably set up for that.
Are you saying mission accomplished?
No, not at all. The mission accomplished is when it's over. When it's over, Jim, mission accomplished. No, I wouldn't say that at all.
Are you certain you'll get the advice you need, sir? Are you certain you will get the advice you need health-wise, in a sense?
What does that mean? Go ahead, repeat your question.
Are you certain you'll get the advice that you need in terms of...
We have great advice. We have great people. We have great people. Yeah, we have great doctors. We have great medical people, laboratory people. I have to say, I think tremendous progress is being made on vaccines, which everybody should be very happy to hear. And therapeutically, I think we're making very good progress, too. We're making tremendous progress. We have the greatest doctors in the world, the greatest laboratories in the world. And I have to say, we're working with other nations. We're working with UK, we're working with Germany, we're working with various other nations who are very advanced and doing a good job. I think therapeutically and also from the standpoint of laboratories, we are laboratories as it pertains to vaccines. We're doing very well. I'd love to see a therapeutic answer even before the vaccine, because we could take care of people that have a current problem or dilemma. But therapeutically and for the vaccines, a tremendous amount of progress. Oxford, Johnson & Johnson, incredible places are doing, I think, a really good job. And they're very advanced, but we have to now see. We're going up to that very delicate final stage with a number. I think a number of other countries are also doing quite well, my people say. And just so you know, working very closely with other countries, and whoever gets it first, my hat's off to them. We're not looking for first, second, or third. We're looking to get a vaccine that works. And progress has been made.
Mr. President, just to follow up on Jim's question, with the doctors saying that there might be a recurrence of coronavirus in the fall, can you just explain why is now the time to wind down that task force?
Well, because we can't keep our country closed for the next 5 years. You know, you could say there might be a recurrence, and there might be. And, most doctors or some doctors say that it will happen, and it'll be a flame, and we're going to put the flame out. We've learned a lot. We've learned a lot about the coronavirus. We've learned a lot about this hidden enemy. It's a dangerous enemy. It's a bad enemy. You see what it does, especially for people over a certain age and people that have an infirmity. If you have diabetes, if you have a bad heart, if you have a certain problem, it just, Myron, it just goes after you. It's vicious. And we're saying that people that are over 60, 65, but over 60, we're even saying, sort of stay back for a while. We recommend you staying back for a while. At the same time, with young children, We'd like to see the schools open early next season and on time. It's incredible how it's very unique how the children aren't affected, but people that have problems and older people can be very badly hurt, injured, or die from this problem.
Hold on, I just want to finish the follow-up. I understand you don't want to keep the country closed for 5 years, but don't you want your advisors to keep looking at this closely the way you have?
They are looking at it very closely. They are looking at it very closely. And I just said it today, I used the word for the first time, I think, in terms of what we're doing. I'm viewing our great citizens of this country, to a certain extent and to a large extent, as warriors. They're warriors. We can't keep our country closed. We have to open our country. Somebody said, we could keep it for the next 18 months. We could keep it for the next 2 years. Doug Ducey's done an incredible job as the governor of Arizona. The people aren't going to accept it. They won't accept it, and they shouldn't accept it. We have a great country. We can't keep it closed. I mean, I've had doctors say, well, why don't we close it for a couple of years? This is the United States of America. I created, with a lot of other very talented people and the people of our country, the greatest economy in the history of the world, the greatest that we've ever had, the greatest employment numbers, the best numbers we've ever had, the best stock markets. I think we had 144 days of record stock markets. And then one day they said, we have to close our country. Well, now it's time to open it up. And you know what? The people of our country are warriors, and I'm looking at it. I'm not saying anything is perfect. And yes, will some people be affected? Yes. Will some people be affected badly? Yes. But we have to get our country open, and we have to get it open soon. Maybe I could ask Doug if you'd like to address that point.
Well, I just want to say in Arizona, we have put public health first. We have looked at the numbers that your medical experts put forward in the Opening Up America Again plan in terms of our symptoms, our cases, our hospital capacity, our ability to surge on our testing. And we're going to continue to put public health first, but we know so much more today than we did 6 or 8 weeks ago. So we believe that we want to protect our most vulnerable. Those are the folks that are of a certain age with the underlying health condition. But the first objective was that the largest places were shut down. Major League Baseball made the decision to shut down spring training. Those are some of the best weeks of the year in the state of Arizona. Major League Baseball has delayed opening day. Schools are not in session. So these large gathering places have dispersed. We've been able to address the fact that we have hospital capacity, ICU capacity, and ventilator capacity if it's necessary. Today it doesn't look as it will be. So we have our arms around the public health emergency in Arizona, and the president, the vice president, and the medical experts, along with the cabinet secretaries, have given the latitude to governors to make decisions on what's in the best public health interest of their state. Arizona is not New York State. It wasn't hit first. It wasn't hit that hard. We've learned a lot from what those states have gone through, and we're going to apply it to protect our citizens.
Mr. President, do you still want the advice of Drs. Fauci and Dr. Birx? Will they still be involved even once the task force is disbanded?
Sure, yeah, they will be, and so will other doctors, and so will other experts in the field. But we've learned a lot. As Doug said, we've learned a lot. You're going to probably have fires here, Doug. You'll put them out. You're going to put them out, and you'll put them out fast. So, yeah, we're bringing our country back, and I think what is going to happen, just said it a little while ago, you're going to have the third quarter where you're going to have transition. You'll have a big, beautiful, hopefully a very good transition, a very successful transition back into the real world. And then you're going to have a fourth quarter that I think is going to do very well. And then I think next year, I think we're going to have one of the best years we've ever had, because we have stimulus and we have a pent-up demand like I have never seen before. You know, today's a very interesting day because it's my first day out, and Doug reminded me of something. I didn't do it for that reason, but you said this is the first place you stopped when you ran, when I ran for something that turned out to be a very successful run. And we had tremendous crowds, remember, at the convention center in Phoenix, and it was pretty incredible. And I didn't do it for that reason, interestingly, but here we are. And it was great that you remind us of that fact. But look, we're going to have a very interesting transition period into the fourth quarter. I think your fourth quarter is going to be very good, and I think next year is going to be one of the best years economically we've ever had. With that said, for those people that have lost somebody, for the people that have lost a loved one, even a close friend, you know, nothing can ever happen that's going to replace that. You know, I don't care what kind of a year you have from an economic standpoint, nobody's ever going to replace that. But I think from an economic standpoint, purely an economic standpoint, I think next year is potentially going to be one of the best years we've had. There's tremendous stimulus out there, and people want to get out. They want to go, and they want to go to town. This country was founded on certain principles, and those principles are at work like you've never seen before. So I want to thank you all very much. Thank you, and we'll see you perhaps at the next step. Thank you.
Thank you, guys. Thank you, guys. Thank you, guys. That way, to the right. Will you get it? If there's a vaccine, will you get it? Coronavirus vaccine? To the right.
What about it?
If there's a coronavirus vaccine, will you get it? Will you take it?
Will I take it?
Yeah.
If they would like me to, I'd go the first one, or I'd go the last one. I don't want to waste it. But he's just saying, if there's a vaccine, would you take it? And she might like it that it didn't work too well, okay? But that's okay. I would absolutely, Jim. If there's a vaccine and if they wanted me to be first online, I'd be first online, or I'd be last online, or I wouldn't take it at all, whatever's best for the country.
All right, let's go, guys.
Thank you.
Thank you, Press. Thank you, guys.
All right.
Thank you.
Oops, sorry, Tom.
is the material that traps the particulates.
of landing. You had a busy day today. Hold me closer, tiny dancer. Count the headlights on the highway. Lay me down in sheets of linen. You had a busy day today. Blue jean baby, LA lady, seamstress for the band, pretty eyed, pirate smile. You marry a music man, ballerina. You must have seen her dancing in the sand. Now she's in me, always with me. Tiny dancer in my hand. Oh, how it feels so real, lying here with no one near, only you, and you can hear me when I say softly, slowly. Hold me closer, tiny dancer. Count the headlights on the highway. Lay me down in the sheets of landing. You had a busy day today. Hold me closer, tiny dancer. Count the headlights on the highway. Lay me down in sheets of linen. You had a busy day today.
Please welcome Honeywell Chairman and Chief Executive Officer Darius Adamczyk.
Well, in a very, very exciting day for Honeywell today, I couldn't be more thrilled to welcome to our new facility the President of the United States and other members of his cabinet, members of Congress, Governor Ducey, Senator McSally. We're thrilled to have you here today. And Mr. President, we all want to thank you for your leadership during this time of crisis for the nation and all the support that we also receive from your administration. I'm personally thrilled that you took the time to come see this new facility, which is going to be so instrumental in fighting the fight against COVID-19. It's an honor to have the President here today. But just a couple of facts about this facility. Normally, to open a facility like this takes about 9 months. This team here was able to accomplish that in 5 weeks. Additionally, combined with the recently opened facility in Rhode Island, we're going to be able to make 20 million masks a month, which is a tremendous amount that will help those on the front lines, and we couldn't be more thrilled to help. But beyond just masks, Honeywell does a lot of other things to help in the fight. So it's a lot of personal protective equipment, whether it be eyewear, glass shields, other gloves. We've more than doubled our capacity for a lot of those items. And also we make sensors for ventilators where we increased our capacity by a factor of 5x. I think what's most important about today is that we're humbled by the fact that we can help those on the front line fighting the battle day to day. You inspire us on a daily basis, and Honeywell couldn't be more proud to help you in that fight every day. It is now my honor to introduce the President of the United States, Donald Trump.
And I'm proud to be an American, where at least I know I'm free. And I won't forget the men who died, who gave that right to me. And I gladly stand up next to you and defend her still today. 'Cause there ain't no doubt I love this land. God bless the USA.
Thank you very much, everybody. It's a great company, and it's an honor to be with you. And we traveled with Darius. He's a great chief executive. He's a great businessman. Done a tremendous job with your company. But I'm thrilled to be here in the fantastic state of Arizona. I love Arizona. With the incredible crew. I had some good moments here, especially on Election Day. It was a good moment, right? But they're incredible, patriotic, and hardworking men and women of Honeywell. Moments ago, we saw the brand new production lines where you're making high-quality N95 respirators, and they are made to perfection. There's no bad masks, like various countries have been sent some very bad masks from other places. There's nothing like that at Honeywell. Respirators are there to protect our heroic doctors and nurses as they fight the unseen enemy. More than 150 Honeywell employees are working around the clock, 3 shifts a day, 6 days a week. You are the greatest industrial, and think of this, what you've done. You're part of this incredible industrial mobilization, the biggest since World War II, hard to believe, for an invisible enemy. But it's a vicious enemy, smart enemy. Like generations of patriots before you, the workers of this factory are pouring their heart and their soul and their blood into defending our nation and keeping our people healthy and safe.
You make America proud. You really do, and I want to thank you very much. That's why I'm here. I want to thank also the entire leadership team at Honeywell, including Darius, who's, again, fantastic man, Ann Madden, Mike Matson, John Waldron, Jim Carroll, Brian Ruddick, William Lang, Tony Stallings, and Romina Cannonshaw. In normal times, it would take 9 months to stand up one facility like this. But Honeywell has built this in less than 5 weeks, creating 500 new jobs in Arizona and another 500 jobs in Rhode Island. Together, these new factories will soon produce more than 20 million N95 respirators every single month, a truly miraculous achievement. We're grateful to be joined by Secretary of Labor Gene Scalia and Governor Doug Ducey. What a fantastic governor he is. Where is Doug? Where is Doug? Thank you, Doug. You're doing a fantastic job. And he already won his election by like 17 points, so I don't have to praise him too much. But I will say that he has been a fantastic governor, and that's, you people recognize it. That's why he had what they say is a walk. It's very good. We're proud of you, Doug. And anything we can do, you're going to call me. We don't have to worry about that. He calls me plenty. He calls me plenty because he's doing his job. But I want to thank you both, and Gene, the job you're doing is fantastic. Thank you both very much. We appreciate it. Thank you, Gene. And I also want to express my appreciation to Senator Martha McSally. Fantastic person. Fantastic person. She's fighting to uncover the full truth about the China situation and how the World Health Organization handled the outbreak and what happened. There must be transparency and accountability. Martha is also somebody that is bringing tremendous amounts of dollars back to her state that she loves so much, the state of Arizona. And I know the governor appreciates it very much, Martha. And I appreciate it very much, too. You're doing a fantastic job, and good luck. Good luck. Thank you as well to Betty and Jorge Rivas at Sammy's Mexican Grill in Catalina. Where are they? They're around here someplace. They're great. Where is the bike? Come on up here. Come on up here. Come on. Say a couple of words. Say, these people, you know, I saw them on television. I saw them on television. They were being devastated by what happened. And I put out a simple tweet saying what wonderful people they are, and they became very rich. They had lines that went around the block. Say a few words, please. Come on. There's a mic right over here. I can't believe I have to socially distance myself from these two people. They're probably the ones that want it from me. Please, say a few words.
Mr. President, we thank you very much. I think you're doing a great job.
Thank you.
I think we represent a lot of the Latino community that is very proud of the job that you're doing. And I think most of us, all of us, all the Latinos are going to vote for you because we think you're doing, like I said, a very good job. And I thank you for all the support that you're giving us. And my wife and I are very happy. And what else can I say? Thank you.
I really appreciate it. That's beautiful. Go ahead. Oh, that's nice. Would you like to say it? Go ahead, please. Yeah, you can pull that down.
Muchas gracias, señor presidente. Estoy muy contenta y feliz. Y de parte de muchos latinos que nosotros conocemos, sé que su voto va a ir por usted. Latinos love Trump.
Ah, that's
yes.
Great people. Thank you very much. Thank you. We'll see you. That's fantastic. So today, they took care of 150 healthcare workers at Devon Gables Assisted Living Facility in Tucson, and they've been helping a lot of the people here get some good food, and they're sending Donald Trump the bill. I can't write it off to the government because they wouldn't like that, but we're paying for it, so make sure you get me that bill. But we have, they are just two terrific people. Again, I saw them on television, and they were having a rough time, and now they're doing great. Everybody knows who they are, and they have lines of people wanting to get in. Food is supposed to be fantastic. To defeat the virus, we are harnessing the unrivaled power of American industry. We're using the Defense Production Act to manufacture over 100,000 additional ventilators on top of our fast-growing national supply. We've mobilized our country. Ventilators are very hard to make, very complex, big, very expensive. And we are now at a point where everybody in this country that's needed a ventilator, right, Doug, has gotten it, especially here in Arizona, everywhere. And Doug's had some extra ones, and he sent them to other places where they needed some help. But we have gotten ventilators to everybody, and now we're actually helping other nations, and we're using them for stockpiles in case this horror show ever happens again. But not a single American who's needed it. I mean, I'm so proud of that. Because when we started with, I use the expression, the cupboards were bare. That means ventilators, and it means a lot of other things. So we're doing something very dramatic, and there hasn't been anything like what we've done since there's a mobilization since World War II. We've dramatically accelerated development of new therapies and potential vaccines. Johnson & Johnson, Oxford, great places, and we have 90 clinical trials underway and hundreds more on the way, and something's going to happen. Tremendous progress is being made. I don't want to talk about it until it's there. We don't want to talk too soon, but I will say, Doug, they really are. They're really, Darius, they're really making progress. You know some of the companies. They're great companies. You know the Johnson & Johnson folks have been really fantastic. They want to get to it fast. So we'll see how it all comes out, and we'll all know very soon, and I think it's going to be a very positive event. Through FEMA, HHS, and our private sector partners, we're equipping our frontline medical workers with more than 70 million N95 respirators, 112 million surgical masks, 7 million face shields, 18 million gowns, and nearly 1 billion gloves. Today, we hear from a few of Honeywell's extraordinary workers who are leading the charge to equip our healthcare heroes and marshal our manufacturing might. That's what it is. It's a manufacturing might that we haven't seen for a long time. Bruno Aguinaga worked at another company for 22 years, but he jumped at the chance to support America and America's war against the virus right here at Honeywell. He's wanted to work at Honeywell always, and he had his chance. Now he is a first shift team leader. Bruno, please come up and say a few words. Bruno? Thanks, Bruno.
First off, we want to say thank you, Mr. President, from the Aguinaga family.
Good.
Folks, so I'm here today to just kind of let you know a little bit of my background and the company that I left to support the N95 mask and the fight against COVID-19 with Honeywell. I was employed with Boeing for 22 years, out in California, relocated out here in Arizona. Got a little chance to work with the folks out in Boeing Mesa on the Apache helicopter as well. It's when I resigned with the Boeing company after so many years to be a part of the Honeywell team. Here at the Honeywell team, they treat you right. It's great culture, great people. Mr. President, God bless America, right? Thank you.
Thank you, Bruno. Great job. Thank you, Bruno. Appreciate it. Thank you very much, Bruno. And the next time I'm here, I think we'll shake hands and we'll hug each other with the job he's doing. Okay, Bruno? Thank you very much. Ursula Warner is a proud Air Force veteran who courageously served her nation in Afghanistan and all around the world. Now she is continuing her legacy of service right here in Phoenix. Ursula, please come up and tell us how you chose Honeywell and why did you do that?
Good afternoon. My name is Ursula Warner. I am an operations supervisor here at Honeywell for the N95 site. I have spent over 20 years serving our country, the United States Air Force. Thank you. Of those 20 years, I spent 15 years in leadership and management positions. Like the President said, served a tour in Afghanistan and a couple of tours in Iraq, and was highlighted by the United States Department of Army and Air Force for that. I just retired this past March, and I actually had a different plan, but after my retirement ceremony and I saw that the site, the N95 site, was standing up and what the purpose of it was for the first responders and our medical personnel on the front lines, I decided I wanted to be a part of that, a part of something bigger, to continue to serve this country in a different facet. I'd just like to thank the leadership and also Honeywell for the opportunity to provide different jobs and things like that for the people in Phoenix, and also me specifically, the opportunity to continue to serve my country on a bigger aspect. Thank you.
She was retired for about 2 days. Retired. Look how young you are. Retired. Thank you very much. Great job, Ursula. Eric Parks is a Marine Corps veteran and the operations manager at Honeywell's new facility. This is a highly personal mission for Eric. His mother is a nurse. His mother-in-law is a nurse. His brother is a paramedic, and his daughter is about to start her first year of medical school at the University of Arizona. That's one of the great schools. Eric, please come up, please. Thank you. Thank you, Eric.
Good afternoon, ladies and gentlemen. My name is Eric Parks, and like Mr. Trump said, I am the operations manager here at this facility. First and foremost, I'd like to thank Mr. Trump for giving this nation the resources, leadership, and guidance that we've needed to navigate through these unprecedented times. Thank you. Thank you very much. Secondly, and more personally to me, I want to thank Honeywell for giving me the opportunity to serve my country again. It fills me with pride to know that the masks that we are going to be producing off of this facility are going to go to first-line responders to help them combat the war against COVID-19. Like Mr. Trump said, this is very personal for me. My mother is a nurse. My mother-in-law is a nurse. My brother is a combat veteran and a paramedic in Tucson, and my daughter has decided that she too is going to carry forward the family tradition of serving. The black shirts that the team down here is wearing says, "The future is what you make it." And I am very honored to be a part of the team that is going to make the future safer, not only for my family, but for many others as well. Thank you. Thank you.
Thank you. As you know, this terrible plague has inflicted grave hardships on our people. We mourn for every life lost. We pray for every victim. And we shoulder this burden together as one people, one family, and one great American nation. Thanks to the profound commitment of our citizens, we've flattened the curve, and countless American lives have been saved. Our country is now in the next stage of the battle, a very safe, phased, and gradual reopening. It's a reopening of our country. Who would have ever thought we were going to be saying that? A reopening. One day they came to us and they said, "Sir, we're going to have to close it down. We had the greatest economy in history." Darius can tell you about that. Greatest economy we've ever had. Best employment numbers, history of our country. Best stock market in the history of our country. Most number of jobs, almost 160 million jobs. We were never even close to that. And they said, "Sir, we have to close it down." It's a terrible thing, but we did what was right. and now we're reopening our country, and it's going to be something very special. I was saying before that we're going to have a transition period. Third quarter, it's going to transition. Fourth quarter is going to be very good, we think, very good. And I think next year we're going to have one of the strongest years we've had in a long time. And that's my ambition, to get it back to not only where it was, but to beyond where it was. And I just want to thank all of the people at this incredible company and this incredible plant. This pandemic has underscored the vital importance of reshoring our supply chains and constructing a powerful domestic manufacturing base. I've been talking about that for a long time. Oftentimes you'd see a plant like this in a different country doing the work you could be doing, and you'll do it better. The United States declared its independence nearly 250 years ago, but in recent decades, Washington politicians allowed our independence to be offshored, outsourced, and ceded to foreign countries. But we're taking it back, and we've been taking it back. And you look at our job numbers, you knew that we were taking it back. When we got up to almost 160 million, something had to be happening. One of the things that happened was we were taking it back. We know it matters where something is made, and we want essential medicine, supplies, and equipment to be manufactured, produced, and made right here in the good old USA. My administration believes in two simple rules: buy American and hire American. In the 20th century, Honeywell workers helped make America the world's greatest manufacturing superpower. This is a great company, and it played a very big role. Now, in the 21st century, right here in Phoenix, Arizona, you're reclaiming the noble heritage and writing the next chapter of this incredible American story. And you have a great governor to lead your way, and you have a great senator to lead your way. You have a lot of people that are leading your way. It was the men and women of Honeywell whose craftsmanship made it possible for Charles Lindbergh to fly across the Atlantic and for Amelia Earhart to break boundaries in the sky. It was the men and women of Honeywell who built the periscopes, mortar sights, and autopilot systems that powered American warriors as they battled the forces of tyranny and fought to victory in the Second World War. And it was the unstoppable workers right here at Honeywell that helped our brave astronauts plant our American flag on the face of the moon, and we're getting ready to do it again. But we're really using the moon as a landing pad for its journey and our journey together to Mars. It's happening very soon. Now it is one more time for the men and women of Honeywell who are supplying the weapons, the armor, the sweat, and the skill in our war to defeat the new invisible enemy, a tough enemy, a smart enemy. But nobody's like us, and nobody's tough like us. And I said it before, and I'll say it again. The people of our country are warriors. With your help, we will vanquish the virus and build a future of greatness and glory. With American heart, American hands, American pride, and American soul. Thank you very much for the incredible job you do. Thank you to Honeywell, to our senator, to our governor. Thank you so much for the incredible job you do. And thank you to the people of Arizona. We will never forget. Thank you very much. Thank you.
glass of wine in her hand. I knew she was gonna meet her connection. At her feet was a footloose man. You can't always get what you want. You can't always get what you want. You can't always get what you want. But if you try some